This is Dr. Al-Hamamsi, one of the teaching faculty in the Internal Medicine Residency Program of Memorial Hospital of Rhode Island. I'm recording this video to explain to the incoming interns how to write a medical prescription. Some of the general concepts that apply when writing a prescription: you first use a prescription pad. So every hospital would have its own prescription pad. Some of the physicians would have their own prescription pad. A prescription pad would have the hospital name. It's going to have the hospital address, the phone number, and the fax number. So when you order a blood test or an x-ray, the facility would know where to fax the prescription and who to contact or where to mail the prescription. And then you start writing the prescription. So you need to write your patient's name and patient's date of birth. So you need to have two identifiers for your patient. And then you need to write today's date. Afterwards, you start writing the prescription. So you need to specify the name of the medication. Lisinopril is a blood pressure medication. And then you need to write the dosing. So lisinopril, 20 milligrams. And then you need to say tablet or capsule. So you can't just say lisinopril 20. You have to say 20 milligrams. And then you say tablet or capsule. You're going to say how it's taken. So you have to say whether it's oral, IV, or IM. You can't just assume that lisinopril is only given oral, so they won't ask you. The regulations say that you have to specify how you want your medications to be given, and you need to say how many times a day. Sometimes you can also specify at what time you want the medication to be given. And then you need to say how many tablets do you want dispensed. So you can't just say lisinopril 20 milligram tablet, one tablet once a day, and stop here. You need to say how many tablets you want dispensed to the patient, and if you want any refills. Afterwards, you're going to sign. If you're a private physician and the prescription pad carries your name, you don't have to write your name again. But if you're a resident physician, you work in a hospital and you're prescribing on the hospital prescription pad, you're going to have to write your name and pager number. So if anything happens with the prescription, the pharmacy would know who to contact. I hope that this video is beneficial and writing prescriptions would be easier. Thank you.